Now, is everyone able to see my screen at the moment? Just trying to get used to this program, so bear with me, everyone, please. Guess we'll get started in another minute or two. Sorry, just having a few issues with this.
Hello, Mr. Anthony, if you can hear me. Hello? الكرام، هل في أحد يسمعني؟ إذا كان في أحد يسمعني من الأخوة المتواجدين بالله يعطيني رقم واحد أو يكتب لي نعم اللي يسمعني. Mr. Anthony, if you can hear me. ممتاز. إذا أنا نعتبر عن الخطأ هي مشكلة بسيطة جدا. هو يحاول أن يتكلم ولكن ما عرف كيفية الطريقة. فأنا أحاول أن أساعده إن شاء الله حتى يبدأ إن شاء الله في بداية الدورة بإذن الله. لحظات لو سمحتم. Mr. Azmi, please, if you can hear me, this is Talal from Saudi Digital Library. Look, you just need to click on the button talk, just one click on the button talk. That's only, just one click on the button talk, and then you can speak. So you don't need to do anything else. Just one click. أستاذ محمود لقموش، أتمنى أنك تتواصل مع المدرب وتقول له إنه إما يتكلم معي على البرايفت أو إنه يسمعني حتى أعلمه كيفية الطريقة. يا ريت إنك تتكلم مع المدرب.
I guess you can use the chat. I guess you can use the chat if you have questions, or you can just talk through the chat on the computer. Thank you everybody for taking the time. Again, I'm very sorry that it did not work the way it should have. I'm used to using a different WebEx system, and Blackboard, this was new. I only learned it within the past 20 minutes, so I apologize. So really, today we're going to go over Access Medicine. And we're really here to just increase your familiarity with Access Medicine. That way we can help you use the resource in whatever way is going to suit your needs and the needs at your institution. I'm Anthony Maricola. I am a digital resources librarian from McGraw Hill in New York. And I'm here to help you use Access Medicine. That way you get the most out of the tool. So I'm going to give you a brief PowerPoint. I'm going to try to go through it a little quickly since due to all the time that I wasted, and again I apologize. But I'll start off with a brief PowerPoint, and then we'll just go into the live site so you can see all the features that are on Access Medicine. Now, Access Medicine has a variety of clinical and educational resources, and these are really designed to meet the information needs of medical students as well as educators and those that are practicing clinicians. Now, Access Medicine is comprised of a number of practical, educational, and learning resources, and that's going to be more than 85 textbooks. And these are going to cover internal medicine as well as a variety of subspecialties, point-of-care diagnostic resources, as well as teaching resources. We also have included with Access Medicine is our custom curriculum tool, and that's a built-in management tool, which is going to be similar in ways to Blackboard where you're managing resources, but you're also going to be able to use these to streamline the teaching and learning process. I'm going to touch on this a little bit later. To go over all the features in custom curriculum, it could be its own workshop on its own. So if that's something that you'd want to see more of, you could let the moderator know, and we could set something up that focuses only on custom curriculum. Now, we have a lot of practice tools that are on the site. So, for example, we have our guidelines feature, and this has digests of guidelines from governing bodies on a variety of topics. And then it links back to the primary literature. I'm going to show you these firsthand once we're on the live site, but I'm just going to give you an overview of some of the great practice tools that you can be using. We also have our diagnostic tests feature, and this is going to have testing guides for use in a clinical setting. We have our QMDT, which is our quick medical diagnosis and treatment section, and this is going to give you concise bulleted outlines of conditions and disorders that are most encountered in a medical practice. They're going to be in really easy to read format, quick to absorb. So for those practicing clinicians, it's going to save you time. You're going to just be able to make a click on the mouse, and you're going to get that information that you need for a quick diagnosis and treatment. We also have our differential diagnosis tool. We call it Diagnosaurus. It's also known as DDX on the site, and that has information on thousands of conditions and symptoms as well as diseases. We also have a drugs database. This is going to have thousands of drug monographs and we're also going to have 20 complex calculators. All of this I'm going to show you once we're on the live site. So you're going to be able to see it live in action. Now, some of the great educational tools that we have on the site. Access Medicine features a self-assessment section, and that's going to have thousands of Q&A questions. Those are going to be both at the clerk and resident levels. We also have a case section, and this is going to give you over 200 plus cases. These are coming from our popular case file series, Pathophysiology of Disease, and it's going to help students develop and understand scenarios in a real-world setting. Now, we have an extensive multimedia library that's over 50,000 images and videos, and you're going to be able to view those images within context to the appropriate resource. So if the image you're looking at is coming from a textbook, you're going to be able to look at that in the textbook where it's mentioned, so that you can use the context as reference. And again, we have our custom curriculum, which I'm going to show you briefly at the end of the workshop. Now, this is a really nice feature, our My Access feature, and all users are going to be able to sign up for a personal profile. It's going to give them access to an added level of functionality. Now, this is a free part of the subscription. It's going to be required if you want to use the self-assessment and case files. It's going to allow you to save and download images. It's going to allow you to print full chapters from the website. And it's really going to enhance and customize your experience. Now, if you're using custom curriculum, for any of those that are doctors and instructors and part of the faculty, if you send me an email, I will be able to give you instructor privileges so that you can create that content for your students. All the students will need to sign up for one in order to receive the content. And it's going to be you can use it as a login mechanism for 90 days. So while you're at your institution, you create your My Access account, you log in once. Now when you're at home or you're on your mobile device, you're going to be able to sign in just using the My Access username and password you created. And you could sign in directly to the site. You won't have to rely on going through the library's homepage, and you'll be able to do that for 90 days. Every 90 days you'll have to re-sign in using that My Access account. And I could show you how to sign up for it once we're on the live site. And another nice feature is that the site is optimized for mobile use. So, if you're using it from a tablet, if you're using it on an iPhone or a Droid device, it's going to tailor itself and resize itself so that you can use the site just the way you would on a web browser. Now, that's my overview via webinar, via PowerPoint. Now I'm going to just go into the live site so that you can see the live site. Let me just make sure that I can get that for you up. So just give me 1 second to find out how I can change that. This one. So now I am going to stop this, and let's get you to the web. Sorry, I put in the URL incorrectly. Just give me 1 second. All right, so it reloaded. Okay, perfect. Now I'm assuming everybody can see the web page. Okay, everybody can still hear me now? I'm sorry, it looked like my microphone had went off again. Now, when I was talking about that My Access account, this is where you're going to create the My Access account. You're going to want to create it here. When you're on campus at your institution, it will display the institution's name here, right in the upper left-hand column. Right-hand column, I apologize. Now, I'm going to sign in with my Access account. So now I'm signed in. Now, since I'm not at the McGraw Hill, New York location at the moment, I was able to just sign in with my Access account, and now I get full access to the site as I would through the subscription. Now, on the home page of the site, you're going to be able to get to all the places that you would on the taskbar above. So the read section is going to take you to the carousel. Hold on one second. It looks like, no, somebody cannot see my screen. Okay, let me see if I can fix that. Share desktop. Now, how many others can't see the screen? Because I'm not sure I know how to load the web page through any of the other tools. It looks like I can't do it via sharing a program. All right, so it looks like quite a few of you can't see the screen. Okay, let me see what else I can do. Okay, let me see. Okay, give me 1 second, and I think I have a way around this. All right, I got it. Now, is everyone able to see it now? Okay, perfect. Yeah, it looks like that other feature we can't use it yet. Okay, perfect. So this is the home page of the site. Now, when you're going to create that My Access account, I'm going to show you. You're going to create it here. So it says don't have My Access account, but you're going to need to create it while you're on your institution's network. So, you know, whether you're on campus or you're getting it through the library's proxy page, the databases page, you're going to want to get it that way. So I'm going to sign in with my Access account, and as I said earlier, I'm not in the office today, so I'm going to get full access to the subscription just using my Access account because I signed in once within the past 90 days. Okay, so this is going to be the home page of Access Medicine. You're gonna get to all the places that you will get to on the home page. You can get through using the navigation bar. So the readings are going to correspond with the readings. The learn will correspond with the self-assessment. The watch is going to correspond with the multimedia, and then some featured updates. Anything that might be new to the site. Anything that our editors update this annually, not annually, monthly. So that they're going to have some updates, anything that they think will be helpful for the doctors and the students, they're going to update. Now, you're going to get to you can get to any of these textbooks by clicking their cover. You're going to get all 80 plus of them. You're going to just click on their cover, and it's going to take you right to that page of that book. Again, you click right into self-assessment or cases. You're also going to get to all of the multimedia this way as well. So the site is designed for two ways, for those that know where they want to go or those that may want to explore. It's going to highlight a different part of multimedia here, and this is one of our videos that we have.
I'm Dr. Sedicott, a pulmonary and critical care fellow at Mount Sinai Medical Center. Patients such as hemorrhage or trauma require short, large bore catheters of either 14, 6.
And it will walk you through that procedure. There's many procedural videos. So what we're going to just do is, you know what, let's just start at the reading section. Now this is where all of the textbooks are going to be housed. You're going to be able to sort and change the way that you view them. For example, if I only wanted to see emergency medicine texts, I'm going to just be able to hone down. If I wanted to see only the texts that are related to neurology, I'm going to be able to do that as well. So I can look at the subcategory underneath. If you're curious to see, this is particularly useful to doctors and the librarians. It's going to download as, it's going to give you a list of all the books. You're going to be able to download it as an Excel as well, and it will give you a list of all of the textbooks and when we added them to the site. So this one was recently added, and it's going to give you that, that stable URL. All of the textbooks down to the chapter level have a stable URL so that you could link right back to that chapter using the URL. This is particularly useful if you're going to be including the link into a Blackboard site, if you're going to include it into a lesson plan or a syllabus. Okay. Now I'm going to click into one of these textbooks so that you can see them. I'm going to use, for the sake of this one, I'm going to use Goodman and Gilman's, but they're all alphabetically. So as you scroll down, you're going to get to the specific book that you're looking for. So since I was looking for Goodman and Gilman's, I'm going to just click on the cover right there. Now you see everything is going to be chapterized. A nice feature that we have also is that you're going to be able to search within the textbook. So if you know that there's a specific textbook that you want to use, but you don't necessarily know what chapter the information you're looking for might be, you could search within that textbook. Anytime anything has been updated in that textbook, whether it's been a concept, maybe it's been a drug guideline, it's going to be updated on this right-hand side, and it's going to let you know exactly what was updated. The nice feature about having all these textbooks digital is that the multimedia will be attached. If you see up here on the image, it says DVD included. No longer do we have to, get that DVD and get it from the reference desk or get it from the librarian. We're going to get all that multimedia that's attached right here. So if I click all videos, it's going to take me to the page that has all the videos that are connected to this book. So I'm going to click into a chapter. That way you could see some of the features. We can hide or we can show. So I'm going to click show. And it's going to drop down all of the different chapters that we have here. So I'm going to click into chapter 17, hypnotics and sedatives. And then it's going to take me down to that chapter level. What's really nice is you're going to be able to toggle through the different sections. So if I came to this chapter, but I know I want to look at barbiturates, it's going to take me down to that specific section. And a nice feature too is some of these chapters can be really long. If you click top, it's going to take you right back to the top. Whenever there is a drug mentioned, so for example, in the chapter there's the drug right here, midazolam. Now it's going to be hyperlinked and it's going to take you to the drug's monograph page. So anytime a drug is mentioned, as well as a corresponding chapter, which we can see below, it will take you to that chapter or it will take you to the drug's monograph page. So I'm going to open this in a new tab. And then it's going to present you with the drug's monograph page. Now, the drug's monograph page, which can also be you can get there using this tab on the navigation. It's going to give you everything that you're going to expect a drug's monograph page to have: dosing guidelines, interactions, usage, anything that you should be aware of for different types of patients, different ages of patients. And you're also going to get some references. Often there's going to be an image of the drug so you can see what that drug looks like. You're also going to get some different names of the drug, in certain drug monographs as well. So if I click on interactions, it's going to let me know how it should be used and why it should be used. Any warnings? Often there will be an FDA warning of some sort, and it will let you know what to be aware of. And there's thousands of these drug monographs. Now, you're going to be able to search via generics, and you're going to be able to do trade names, as well as the different drug classes. And what's really nice is that there's these patient handouts. So if at the point of care, if you were prescribing a patient on a specific medication, you're going to be able to have this little printout that you could print and give it to the patient at point of care, just so that they have a little bit of information on the drug and what to be aware of. So now I'm going to go back to that. I'm going to go back to the chapter page. Everything's going to be really easy to read format. It's going to be seamless. Each chapter follows the previous chapter. Again, you're going to have this stable URL. The durable URL will go back to that page. Now you're going to be able to view. You could change the view. You're going to be able to view full chapter, or you're going to be able to view the table only. So if you want to just see the tables that correspond to the chapter, you're going to be able to do that. So these are just the tables that are in this chapter, and we can view them large. Now I'm going to toggle back to the full chapter. On the right-hand corner, you're going to get the related content. So these are any chapters from any of the other texts that have related material. So it looks like Tint and Alleys has something that's related to hypnotics and sedatives, as well as some of these other texts, basic and clinical pharmacology. It has a sedative and hypnotic drugs. So all I do is click that, and it's just going to take me to that chapter. Now, some of the features you're going to be able to print. Now, it doesn't allow you to save as a PDF, but if you print to PDF, you will be able to do that. So, for example, if you wanted to read a chapter while you were on your mobile phone or tablet, you're not going to be able to print it. You'll have to save it as a PDF from the print option, and then you'll be able to you can either email it to yourself or send it via your computer. Now, this is how it will print. You're going to get all the full color images, any of the graphs and charts, and you're going to get all the images as well. You're also going to be able to email it. So if you're emailing it to a colleague, and your colleague does not have access to Access Medicine, the link will stay alive for 7 days. So if you were sending it to your colleague, we could even say maybe you had your colleague was traveling in a different country and didn't have access to the database, you could send them a link. You'll be able to email that chapter with, using the email thing provided, and you'll be able to send them that link. They'll have it for 7 days. They'll be able to view the chapter. They can view this hypnotic drugs chapter for 7 days. After 7 days, the link will no longer work. If you have access to the database, you get continued access with no problem. Now, for those that need the citations, it's available in AMA, APA, and MLA, and then you're going to be able to download it to any citation management software. So if you're using RefWorks or you're using EndNote, you'll just download that file, and you'll be able to open it up in that program. Now, again, you're going to be able to search within the textbook. Now, the clip feature is something that is for custom curriculum, and I will show you that once we get to custom curriculum. That's an instructor-only feature. So for any of the doctors that need that instructor access, I will put my email up, and then you'll be able to see that. Everything looks like it should be working fine, or at least I hope. Now, this is basically the end of the textbook section, so I just wanted to leave it open if there were any questions. You could send them via chat. I'll be happy to answer. It looks like my mic is still active, so you can hear me, I hope, and you can see the web page. So yeah, if there's any questions, feel free to send them via chat, and I'll be happy to answer them. I'll move on to the next chapter, but if I see any questions pop up, I'll be happy to answer them. So that's the reading section. Again, you click into the reading section, you'll get access to all 85 plus titles. Just click onto the chapter. Fully digitized, easy to read, includes all of the charts, and it's really a great tool. Now, the next section that we're going to have is going to be, actually, you know what? Let's take the search engine on a spin real quick. So I'm going to just search for something. I'm going to search for nocardiosis. Now, when I'm searching, the searches are going to be conducted in semantic, and it's going to be doing a full search text across the entire site. It's going to support enhanced searches, so if you're using Boolean operators like and, or, not, you're going to be able to do those searches. Again, it's going to do all of the texts, and it's going to also show you related images. It's going to show you related content that comes from other parts of the site. So I search for nocardiosis. It's pulling information from the textbooks. It looks like I have 130 hits. I also have some of the quick diagnosis and treatment section, our differential diagnosis treatment, as well as our Harrison's manual and our images. So I'm going to narrow the topic, which by clicking this bar, this box, you're going to be able to. So maybe I can hone it down to nocardia. So it's giving me the 12 textbook sections that I can click into that will have that specific topic that I'm using. Now I'm going to click on images, just so you could see some of the images. Any images that are related, they're going to pull up, and again, you could view those in context. So you're going to see exactly where that image is showing up so that you can get the chapter information on it and get a better understanding of why that image is being showed. So it looks like we have an image, we have a little summary of nocardiosis, and we have an image of what it should look like. Oops, sorry about that. So now I'm going to go on to the next section. I know we're running a little behind, and that was because of my connectivity issues, so I apologize. So now the next section is going to be our quick DX and quick RX and DX. Now this is our section of quick reference tools. These are going to be really great for those doctors that can use this at the point of care, as well as use it as a teaching tool. Now the quick RX DX, this resource is coming straight out of Lang's QMDT. It's going to give you those really concise bulleted outlines of conditions and disorders that are most encountered in a medical practice. So for example, I'm going to click on anemia, iron deficiency. And you're going to get hundreds of those. You're going to be able to just click on the different alphabets for the different disease. Now, I clicked on anemia, and it's really giving me all the essentials that I need to know about diagnosing anemia, as well as the different types of tests and treatments that I should be aware of so that I can test. It's going to be in a really quick, easy to absorb format. It's going to give you all the essentials that you need, as well as any related information. So for example, now we see, now that we're on anemia, it's going to give us the essential diagnosis, what it is, any general considerations, the causes to make sure that, we're not ruling anything out and we're testing the patient, any of these clinical findings, signs and symptoms, any differential diagnosis, things you might want to rule out before diagnosing with a patient with anemia, any of the laboratory tests, as well as what to look for in the tests. Any treatments, medications that they should take, maybe a diet. Again, you see that this drug is hyperlinked, so that will allow for you to go right to that monographs page. The desired outcome, what to do. This one says that there should be a follow-up, and any references. And these are going to link out directly to PubMed. So if your institution has this database access to this article, you're going to be able to go straight there if the link resolver is set up. Again, you're going to be able to cite this, and you're going to get a lot of the tools that you would have gotten, that you get from the textbooks as well. So I'm going to click top. Now again, if there's any questions as I go, just please feel free to send them in the chat. Now the next section is our guidelines. This resource is pulled from current Practice Guidelines in Primary Care 2014. This specific text is going to be updated annually. And it's digests of guidelines that are written by governing institutions and boards. So I'm going to look at, let's do a disease screening. And since we were on anemia, I guess we'll do anemia again, just so that we can, I can give you a full example using that same disease. So now, if you look at this, it's going to give you all of the guidelines, the screening guidelines, for a number of different age ranges. You have for pregnant women, for infants. Now, you're not going to have to go to all of the different organizations to pull this information. So I'm going to view it as a large table so that you can see it. Now, this is pulling from the AAFP. We have the USPSTF. You would have to go to all these sites to compile this information, and it could be time-consuming for a busy physician. This way, you're going to have, now if the patient that you were seeing that you suspected had anemia and you wanted to do the screening, maybe it was an infant aged 6 to 12 months, you're going to have that information right here. And it's going to link right to the primary resource. So the link will take me right to that AASP's site. Now, I could save that table. Since I signed into my MyAccess account, I'm going to be able to save that table. Let me see if I can save it from here. So it saved it to my MyAccess account, as you see. And again, you could print. I'm viewing it large just so that I can see it. But again, you can have hundreds of these. As you see, for an abdominal aortic aneurysm, you're going to have all that screening information. Now, the next section is going to be our algorithms. Now, the algorithms are a database of decision-making trees, and they're going to be for treating over 1,000 medical conditions. It's going to be a great resource on those times when you don't know what the next step is going to be. So, for example, if we had a patient and the patient was exhibiting abdominal trauma that was penetrating, we may not know what the next step should be. I don't know why this one showed up like that, but let's use, what else could we use? Let's say we had a abnormal weight loss. Sorry, I don't know why those are not showing up. Let's see. Might be doing some updating on the site, and sometimes as they re-upload. So you're going to have the algorithm. Is the patient exhibiting this? If it is, go to this. It might be this. If the patient has something that's normal, it may be easier to decide what the issue is. But there's thousands of these. These are going to be helpful too, because you can download them into a PowerPoint. So if you were doing a lecture, or you wanted to send your students information on this, you're going to be able to do that, and it's going to just download as a nice PowerPoint. Let me see if it's going to show up. So as it downloads as a PowerPoint, it will upload as a PowerPoint. It's not going to let me show it only because then I have to change into the different program. And if you want to view it in context, you're going to be able to do that. And it will take you to that chapter level. Now the next section is going to be our DDX. That's going to be our differential diagnosis tool. We like to call it, sometimes we make a joke, we call it DDREX because of, Dr. Diagnosaurus in the left-hand corner. Now, this is going to have information on over 1,000 different diseases and what their symptoms could be. This is going to be particularly helpful because it can help pinpoint a medical problem. You're going to be able to browse by symptom. So if we had say we had a patient that was exhibiting abdominal pain in the left lower quadrant. We're going to be presented with many different conditions that it could be, listed to most frequently occurring to least frequently occurring. But it's going to be really helpful because we could, it's going to show us all the possible conditions that this symptom, might be. So, for example, a resident is going to want to make sure that they ruled out all of the conditions before diagnosing a patient with, say, constipation or, cystitis. And again, you could search through, you could do all differential diagnosis, you can browse by symptoms, you could do by disease, and you're also going to be able to do organ system. Now the next section is going to be our diagnostic tests. Now this is a reference manual and interpretation of tests that are found in a medical environment. It's going to provide information on what the different tests will do for you. So you're going to be able to do different tests, say, echoes, imaging. I'm going to click on lab tests. Now if I wanted to do a test on Lyme disease, I'm going to be able to select the Lyme disease from this section. Sorry, it's taking a little long and my internet might be, we always have internet troubles in New York Now, it's going to be similar to the other guidelines that you had seen with the governing bodies. I'm going to just be able to, I can save that table as well if I wanted to. So it's going to let me know what to look for, the testing ranges, what kind of tests, and how to interpret those tests. So if I was unfamiliar with Lyme disease testing, this would help me. This would help me know what tests to consider and how to read those so that I can give a positive reading of a Lyme disease test. And any of those, there's also these references that will be helpful too. So it will go directly to that PubMed if your institution has the link resolver set up. I don't know if there's any librarians on the line, but if the link resolver isn't set up with your other databases, you could send me an email as well, and I'll be happy to help you with that. And there's going to be hundreds of those. Finally, on the quick reference section are these calculators. They're really there just for your convenience. They're going to just help you save time. So if you needed to do a quick BMI, body mass index, you're going to be able to just plug in the coordinates. I'm going to just do one at random. And it looks like that's me. It looks like I fall in the appropriate normal weight. We already went over the drugs monograph page, so I'm not going to spend any more time on that. If there's any questions about it, feel free to let me know, and I will I'll go over more of them if you'd like. Now, the multimedia section is extremely robust. It's an extensive collection. You're going to be able to search by category. You're going to be able to search by system. There's musculoskeletal exams. There's patient safety modules. There's lectures and a very extensive image library of over 50,000 images. Similar to the books, they're going to have that unique URL so you can copy and paste if need be. You're going to be able to view in context. I'm going to go over this briefly, but I implore you to go through it when you have the time and go through all of the different multimedia. It's very robust. I'm going to let's do cardiovascular. And now these are some of our office-based procedure videos. So I'm going to click on play just so you can briefly see.
I'm Dr. Sedicott, a pulmonary and critical care fellow at Mount Sinai Medical Center. This instructional
they're chapterized as well.
Indications, contraindication, antiseptics, hygiene, prior to putting on gloves. Place the patient in a supine position with the extremity for IV placement being evaluated and supported. Make sure that you have adequate lighting.
So we will walk you through step by step what's expected for that procedure. You're going to be able to search, videos through system as well. So if I wanted ear, nose, and throat, it's going to pull all the videos that are related to that category. We have our Exploring Radiology section, and that's going to help medical students and residents develop their imaging interpretation skills by viewing important concepts in radiology. So they're going to know what to look for by looking at these different radiology images. You're going to have the patient safety modules, and these are an interactive self-paced study pertaining to key concepts like hand washing and communicating with patients, and then the residents or students can take a test after reviewing. So they're almost like these little self-contained modules, self-paced study. So I'm ready to go to the first module. And it's going to just give them some questions. They're going to answer the questions, and then they're going to move on to the different sections, and then they're going to be retested later on. I'm clicking these on random, so if I get them all wrong, don't be too harsh. I'm just trying to save some time. So then I'm going to be able to move on to the next steps. And then I can follow this whole module throughout, and then test myself, make sure that I link up the appropriate answers to questions.
This is not the correct match.
We also have our lectures feature, and these are going to be our Grand Rounds lectures. They're a series that they cover a wide variety of topics. They come from Harrison's Online, and they're around 30 to 50 minutes each, but they're similar to rounds at a hospital. They're chapterized for easy reading. They're also going to increase medical knowledge, and they present a bigger picture of the concepts. They're typically presented by well-known doctors in their field who have had many years of experience working with patients. So similar to some of the videos, they're going to be, the procedural videos, they're going to be chapterized.
Perioperative management of anticoagulation. I'm Dr. Stephen Cohn, Director of the Medical Consultation Service at Kings County Hospital Center and Clinical Professor of Medicine at this. What options do we have for perioperative anticoagulation? Well, the first is that we can continue the patient on warfarin and operate with full anticoagulation on board. What procedures can we do without stopping warfarin?
Now you're going to be able to get the thumbnails. You could get the transcripts. So if there was part of it that you wanted to just read, you're going to be able to do that.
Perioperative management of anticoagulation.
We also have this interactive female reproductive system. It's an interactive module that will just help map out just some different parts. Sorry that it's taking a little longer to load than usual. But while that loads, I'll just go to the next section. Now, the next section is going to be our case files. These are really useful to medical students. They're going to be a really great tool for enhancing diagnostic skills, and it's one of the most popular resources on the site. I'll load that module later, just to save you some time. Now, there's a selection of cases. They're from our popular case file series, Pathophysiology of Disease, and it's going to help students better understand and evaluate real-world scenarios by offering them questions to frame the case and the approach towards the patient. Students are also going to have access to Hearst's imaging cases, which can be used to improve visual diagnostic skills. So I'm going to just click one on random. I'm going to do an internal medicine, and we can do hypertension outpatient. So we're going to be presented with a case. It's going to be situated around a real patient, or at least a patient scenario, rather. It's going to explain, what the patient is coming in for, any background information. Then you're going to get some questions. What are your next steps? Then it's going to give you an approach, as well as some definitions, a clinical approach, any clinical pearls that you should consider before diagnosing, any references for further reading, and then you're going to get comprehensive questions. So I'm going to just click on these at random. So I did terribly. So I should not be diagnosing this patient. So I got all of the questions incorrectly, but it's giving me some related topics and letting me know what the correct answer is, so that I can go back and do some further reading. They're really just they're easy to use. They're going to just test the student's knowledge. I'm going to go back to the cases, and you see there's quite a few of them. We could do case number, or we can view by topic. You're also going to get a series of different cases like, biochemistry cases, pathophysiology cases. Really good for testing. Here's the Hearst imaging cases. There will be a thumbnail of the image. It looks like I'm just having a lot of trouble with my internet today. As you see, it's just taking a little longer to load. But there will be a little view, and then the student will be asked to, help diagnose or at least come up with some sort of treatment plan. Now, following that is going to be our self-assessment. Now, the self-assessment is going to allow you to create custom exams for yourself. The questions are going to come from a multitude of resources. The user, it's going to be a really good tool for the users, especially if they want to have remediation in a specific topic or subject. And users are going to be able to combine resources. So I can use all of these different resources to pull together a custom quiz for myself. Now, this is also useful for instructors as well as the practice link clinicians and those who are managing rotations, because they can create a custom quiz and then send it to their students. So let's see. It's going to let me search by different topics. So if I only wanted to focus on neuroanatomy, I can do that. So let me see. I'm going to just click on basic clinical biostatistics. This may not be, it may not pertain to your area of study, but I just want to use it as an example to just show you the different questions. Again, I apologize for that small delay, that lag on my end. I know we're a little over. I should probably have this wrapped up with maybe another 10 minutes. Then I can go over anything else that you'd want to see again. I apologize if I went through anything too quickly, but I'll be happy to go back and show you anything. So now here we are. I could select all of these different sections. It's going to let me know how many questions are available for me to select. So this has 65 questions. I'm going to just choose 2. I'm going to select something from spinal cord. Let's do functional systems. 2 from there. I can also do something from pathology, and I'll do 1 from there. But you could select as many as you want. As you expand them, it will give you more subspecialties under that topic. I'm going to start the test now. Now again, you're going to be presented with a question. I'm going to answer randomly, so I may get all of them very wrong. Occasionally, I'll do questions and everyone will be right, and it becomes very impressive, But lately, I haven't been doing too well. Okay, so it looks like I only answered 1 of 5 correctly. So as you see, you're going to be presented with the correct answer. And it's going to also give you related topics. And then you could email your results. So this is particularly good for those that are teaching, because then they're going to be able to have the students tell the students do 10 questions in this category, and then they could email it to you. There's also a unique URL for those answers. So the student could, if you're using Blackboard and you're asking the student to upload, the student can upload their link. The link will make it available for everyone else to see, but it might be helpful. It may be helpful for students to learn that way. Another really, really new feature. This was released, I would say, maybe 2 weeks ago. It was live on the site. It's going to allow colleagues, students as well, they're going to be able to test their medical knowledge against each other in a quiz bowl style game, similar to Jeopardy. Now, I'm going to go over this really quickly, but it will create competition, but in a fun way. So I'm going to start a showdown. Again, I'm sorry that it's a little slow. It will be working via Flash, so it shouldn't take too long to load in your browser. Even if you're watching along, feel free to go on Access Medicine if you can and play along. Just give me a second. Let me try this again. I was having some issues. I think it might be a browser issue with my cookies. But let's try again. It's a really fun tool. I was playing around with it during beta, and it was really fun, and it was to get really competitive amongst doctors and students, because you'll be playing against it'll be playing against each other. But another nice feature is that you can play against the computer. Now the MyAccess account is required. So whenever someone creates that MyAccess account, their name will be available to select to play against. And I'm sorry that I keep getting this message. I really wanted to show you the... Give me 1 second, and I'll try that again. Now, while this is loading, if anybody has any questions directly from me, feel free. Just send them via chat. I'm happy to answer them. I'm sorry, guys. Let's go to the next section, and then I will go back to that so that you can see it. I would really like to show that. We also have our patient education handouts. These are going to be available in several different languages. They're simplified. I would say they're at maybe a seventh grade reading level, so they're really easy to read for the patient, and it's really a point of care tool. So if you did tell someone that they had an aneurysm, this will be a PDF that you could print out that you can hand to them to give them a little more information on their condition. What are the symptoms, what are the causes, how is it diagnosed and treated, just some helpful information that could give them a better understanding of what issue they're going through. And to toggle between the languages, you'll just do that. Not everyone is translated. The majority of them are in English. You're also going to have the pediatric advisor as well, which is just going to have more conditions that are focused on the pediatric audience. And then our custom curriculum tool. Let me try Showdown once more. I would really, really like to show it to everybody. And everybody, I thank you again for all your patience. I know we're running a little over due to my technical trouble in the beginning, but I appreciate it. All right, I'm still getting trouble. I was asked to repeat this step. I'm assuming that you want to see the patient ed again. Was it the patient education? Just send me a chat again so that I know what section you wanted to see. But to go to the patient ed, it's just going to be that last section, and you're going to be able to go by the different symptoms and diseases via the alphabet. So, if it was aneurysm, obviously it'll be under A. If it was Lyme disease, it'd be under L, and then you'll have your PDF that you can download. Now, I'm going to go over the custom curriculum. I'm going to show you a pre-made custom curriculum. This way, it will save some time. But if anyone is interested, let the other moderators know, and we can set up our own custom curriculum workshop. That way, for those that want to use it actively, we can go over all the steps. I can walk you through creating everything. So so this is what my dashboard looks like. You're not going to see all of the databases because you don't have access to all of them, but you will see the database that you do have. You will see Access Medicine here. Now, this is some of the modules that I've already created, but you're also going to be able to look at some of the ones that were previously created. So I'm going to click on Access Medicine 1, and it's going to be Internal Medicine Clerkship modules. So if I was doing a clerkship on cardiology and I wanted to teach something, I'm going to click on hypertensive disease. Now, as you see, there's going to be a multitude of resources that are added here. Now, just a little overview, our custom curriculum tool is an integrated learning management resource. It is similar to Blackboard in some ways, and it's going to enable you to create customized assignments that can be pushed out to the learners. The instructors are then going to be able to track how their students are doing through the assignments, and it could be used as a rotation tool. So here we're seeing a curriculum on hypertension. It has a mix of tests, chapters, case files, all resources that were pulled from the site, Access Medicine itself. But you can also use external content. You're not limited to only content that's in Access Medicine. You can add journals, you can attach files, you can attach PowerPoints, Word documents, images. You could have links to other databases, to even YouTube videos. You're going to be able to create an assignment that encompasses multiple resources. So I'm going to now go back to mine, just so that you can see an example of what the full one looks like. So here's hypertensive disease. And mine has a pretest in the beginning. Now the pretest you can make required or not required. So when the students do go to attempt to do this, they're going to be tested before they can get access to anything else. Now if I look at the student view, I'm going to be able to look at the learner view. Now this has a current page from the current diagnosis book. It has a PubMed article. Now the PubMed article was external, so I added this. And I also added a PowerPoint. I wanted the students that I was creating this for to have that PowerPoint. And there was part 2 of the presentation. And then at the end, they were going to have a test that was auto-generated with questions from the site and a post-test. Now, a really nice feature is that you can create your own test. So if there's a test that you're used to administering to your students, you can create that test on here with multiple choice answers and send it to your students. So I'm going to look at the learner view just so you can see what it'll look like for the student. Now mine is past the deadline, but that's all right. Now I'm going to do this cardiology, the one that I was showing you. So now this would be the student view. So now I'm going to click into hypertension. And this would be the test that they would receive, but they would be allowed to select their questions. This is possible that I already I answered my questions. And this is what you as the instructor would end up seeing. You would see how they did on that. So this was a pretest. It was auto-generated pretest. After that pretest, was a chapter 13 about hypertension. So that chapter is just going to take the student to that specific chapter page. Now it's required, so it means that the student has to at least click on it. Obviously, we can't track if they're reading it or not, but it does have to be opened. So as they're doing their tests, looking at their activity, you're going to be able to monitor this. And you're going to be able to see how they're doing on this and how much they've completed. So when I click back to see the learner, it looks like I completed 75% of it as a learner. But this one was completed, and I was ready to submit, but I did not submit it, so it's already past the deadline. Now I'm going to go back. Now, when the student, everyone will have to have a My Access, and then you're going to be able to create student groups. So if you're teaching if you're doing a class or a rotation of 200 students, you're going to be able to send these assignments just to those students. You're going to be able to create separate student groups. Now I'm going to go back. Now when we're on Access Medicine, you're just going to click on that custom curriculum tab. And you're going to be able to pull information several different ways. So I'm going to work on that cardiology, and say I wanted to add more content to it. I'm going to be able to clip the content from the site, or I could use a URL. As you know, most of the content has a stable URL, durable URL. So if you know if you have the URL to the chapter, you just have to add that URL in there. Or you can use any other, you could use any other URL that you want. Now the clip content is going to allow you to clip the different content from the site. When you saw that little scissor tool, now the scissor tool is only going to be available to instructors. So I'll put my email up, and then you can either email the moderator or email me, and then we'll make sure that you get those instructor privileges. So I'm going to just show you, this may not be relevant to the hypertensive module, but I just wanted to give you an example so that you can see how the tool is used, the clip tool. Typically on your end, the internet should run faster. I'm having a little delay because the wireless where I am right now is not fast. So I'm going to click this tool, and then I'm going to click right here. Now it's going to allow me, it's going to ask me where I want to put that section, that chapter section. So if I wanted to put it here for my hypertensive disease, I can do that, and then I could just add it to the selected module. Then I can go back to that hypertensive module. And here's that. Now I don't want it over there, so I could just reorganize it. I may be able to just get rid of it altogether because it may not be something that I wanted to add, or I may think that the module is too long already. So all I do is click this, and it will remove. You're also going to be able to add a test. I'm not going to go through the test adding just because it is very time consuming, and I already have you over a half hour, and I'm sorry about that. You're going to be able to add a test. You can do a Q&A where you select the questions. You can do a Q&A where it's random, and those two choices come from the text that we have here, from that self-assessment section, that Q&A section. Or you can add your own test. That way, say you have question bank that you like to use, that's your own that you created. You're going to be able to set up the multiple choice that way too, just like you would on any other multiple choice test. And you're also going to be able to add that external material. So I have a PowerPoint that I added. You can add a PowerPoint. You could add any other external documents you want, any files, Excel spreadsheets, and you could also make those optional for the learner. So this is just a way to incorporate the content that is in Access Medicine with some external content and have everything tracked under one site so that you don't have to, you'll have everything here. You can really utilize all the content that is in Access Medicine, which there's so much of it for teaching. And it could really help with that rotation management, and it could really help with educate those students. Now let me try to get the showdown to work for you. And after the showdown, you are all free to go. If you have any questions, again, feel free to just ask. Just let me know via chat, or you can ask the moderators as well. The site was working for me earlier before we did the webinar. It was working, so I did test it, and I was excited to show it. Let me see if I can log in again. All right, so I'm going to log out, and then I'm going to just log back in with my Access, and let's see if that did the trick. If I cannot get it to load and there's anyone that would like to see it, later on this week, let me know, and I could even just send you I could do a screencast of the video, of how to use it, or I could just send you some images. I don't know why it's doing this. I'm going to just delete my browser history real quick. And then I'm going to try again, and we'll see if that did the trick. I'd really like to show it to you. It's a really nice feature. And I know our editors for Access Medicine, they put a lot of time into getting this really nice tool. All right, let's try Access Medicine again. There we go. I'm very happy that it's working now. So this is going to be the dashboard. I was playing a game against the computer, and that was the game. But I'm going to start a new game for the sake of this one. Now, I can select my difficulty. Right now we have student and intern. We're hoping that we can maybe get resident added. I'm going to just do all. I'm going to do all as well, but you can select a different topic. Again, you could do different exams. I'm going to do let's do physical exam. I'm going to do, for the sake of this, I'm going to do the computer. But if I was to select opponent, I would just type in the name. So here's my colleague, Callie Covert. She's also a digital resources librarian, so I can add her to this game, and she'll get an alert that says, you have been asked to join a showdown. For our sake, I'm going to just do a computer. And then we can do we'll do one time. And now I'm going to start a game. So we're going to be presented with the different categories, and we're also going to have the different values, how many points they're worth. So if I was to do 300 for chess, I'm going to be presented with a question. Now, I don't know this answer. So for me, I'm going to have to give up instead of submitting something. But if I did submit, it's going to let me know that that answer is incorrect and what the actual correct answer is. Oops, sorry about that. Typically, the backspace will get you out of that after the question. Let's see if we can get it back up again. I'm sorry. All right. So it looks like we're having that same trouble again. I'm going to find out what that trouble is, but I urge you to play around with the Showdown tool, and check it out, and play some games on it. It is really a fun tool. So it's one of those learning tools that you can have a lot of fun with. That's basically Access Medicine. In a nutshell. If there's anything you'd like to see deeper, if there's anything more in the multimedia you'd like to see, feel free to let me know. I'm going to just put up that PowerPoint again if I can see how to do this. Let me see if I can stop this, and then it will have my it'll have my email on it. One second, again, I'm sorry about that. So it looks like it's sharing my desktop. I hope that it works. Yep, It should. So my email is right here. If you have any questions, really, feel free to reach out to me. If there's anything you need, I have instructor guides for the I just wanted to make sure that I was still talking. Yeah, I have instructor guides for the custom curriculum, so we can walk you through how to create it step by step. We have YouTube videos too that will walk you through it. I can give you a pre-recorded webinar if that's something that's helpful to you. But yeah, just reach out to me if you want instructor privileges. Create your My Access account, email me your username, and I'll put those privileges on your account, and then you can get started creating curriculum if that's something you're interested in. And again, if there's any questions, feel free to ask. I appreciate everyone taking the time this evening to sit in on the webinar, and I thank you very much.